learners, you will in this lecture you will learn about the basics of exposure, risk and vulnerability, and myself Dr. Netanand Sahu from Department of Geography, Delhi School of Economics, University of Delhi. And in this the learners outcomes, the learners will understand like the understanding regional health disparities. Also learners will learn like climate influence on health, and learners will understand the socio-economic impact on health. Learners will know the effects of urbanizations and also the environmental health challenges, government policies and responses. Then learners will know also impact of health programs, then public health strategies and role of cultural practices, and also learner will know like the importance of tailored interventions. So let us have introductions. Like within this, like let's within introduction, factors influencing health related exposures. So climate is a factor. For example, regional climatic conditions like heat, humidity, rainfall and significantly influence the disease patterns. So socio-economic status like poverty, malnutrition and lack of access to health care are critical determinants in many regions. Urbanization like rapid urbanizations, particularly in the western and southern India, has led to lifestyle disease becoming more prevalent in these areas. Then we have like environmental issues like pollutions, contaminated water and deforestation contributed to various health issues across the country. Number 1, like climate plays a significant role in determining the types of disease prevalent in different regions of India, and within the different regions we can have, for example, northern India like Himachal Pradesh, Jammu Kashmir, and we have like cold climate. For example, the harsh winter months in these hilly regions lead to cold related ailments like frostbite and hypothermia. For example, in Leh Ladakh, cases of frostbite are common during extreme winters. And also we have like respiratory issues like due to the cold indoor air pollution from wood burning, stoves and the use of traditional heating methods lead to respiratory problems like chronic bronchitis, especially in the rural areas. So within western India like Rajasthan and Gujarat, for example, hot and arid climate like Rajasthan, particularly in cities like Jaipur and Jodhpur, experiencing extreme high temperatures in summer leading to heat related illness such as heat strokes and dehydrations. Then like seasonal rainfall during the monsoon seasons, regions like Mumbai in Maharashtra experiencing heavy rains leading to waterlogging and a spike of waterborne diseases like leptospirosis we can have like, and also dengue. Then we have northeastern India like Assam and Arunachal Pradesh, like we have high humidity and rainfall. So the high humidity and heavy rainfall in eastern India, particularly Assam and also Meghalaya, that belts make it breeding ground for mosquitoes leading to high malaria incidence. For example, Assam's tea garden areas are particularly vulnerable to malaria outbreaks during monsoon period. And then we have socio-economic status, like socio-economic factors such as poverty, education and access to health care significantly impact health outcomes across different regions. Let us example of eastern India. For example, Bihar and Jharkhand, poverty and malnutrition. Bihar and Jharkhand have some of the highest poverty rates in India, leading to widespread malnutrition, especially among the children. For instance, Bihar has a high prevalence of studied growth in children like due to chronic malnutrition. So lack of healthcare facilities in rural areas like Bihar, the lack of access to quality healthcare are exacerbate conditions like maternal and infant mortality rates. Many villages are far from the nearest health centers, leading to delayed treatment for common ailments in particularly the eastern India. Then central India, for example, Madhya Pradesh and Chhattisgarh, we have tribal and remote areas. In Chhattisgarh, particularly in tribal regions, there is a limited access to health care, leading to high rates of disease like malaria and tuberculosis. For example, the Buster region has been reputed to have high rates of malaria with limited healthcare infrastructure to manage outbreaks. Then urbanization, like rapid urbanizations in the eastern regions has led to the shift in disease patterns, like with lifestyle related disease becoming more prevalent. Let us example of western India like Maharashtra and Gujarat, urban health issues like cities we have Mumbai and Ahmedabad have seen a rise in lifestyle disease such as diabetes, hypertension and cardiovascular disease due to sedentary lifestyles and unhealthy diets and stress. For example, Mumbai has one of the highest rates of diabetes in India. Then another factor which is very important also, like air pollution. Because of rapid rate of urbanization also contributed to poor air quality. In cities like Mumbai, Pune, air pollution levels are constantly high, leading to the increased access of respiratory disease like asthma and pulmonary obstructed disease. So then southern India like Karnataka and Tamil Nadu, like lifestyle disease, for example Bengaluru in Karnataka and Chennai in Tamil Nadu are experiencing a growing burden of non-communicable disease and like obesity and heart disease due to changing dietary habits and reduced physical activities. For instance, Bangalore has seen a significant increase in the incidence of obesity related complications among its populations. Then environmental issues. Within the environmental issues, for example, environmental factors such as pollutions, deforestations and water contaminations significantly impact the public health across various regions. Okay. So, northern India like Delhi, NCR and Punjab, air pollutions very serious in Delhi. NCR faces severe air pollutions, especially in winter months due to the crop burning of neighborhood states like Punjab and Haryana. This results in high level of particulate matter leading to respiratory and cardiovascular disease. For instance, the region has been a marked increase in the cases of asthma and other respiratory issues during the smog seasons. And let us another example of eastern India, West Bengal. Arsenic contaminations. In the Gangetic plains of West Bengal, particularly in the districts like Murshidabad and Nadia, groundwater contaminations with arsenic has led to chronic health issues such as skin problems, cancers and cardiovascular disease, and long-term exposure has resulted in widespread health problems. I think there are many research has been done also in the West Bengal, particularly arsenic contamination in the water, and that also affected the different communities. And in the northeastern India like Meghalaya and Assam, we have like deforestations and soil erosions. In Meghalaya, deforestations for coal mining has led to soil erosion and contaminations of water sources, impacting the health through the spread of waterborne disease. Additionally, the heavy use of limestone in the mining region has led to respiratory issues among the workers and nearby communities. So, there and also we have like cultural practices and traditional beliefs, like cultural practices and traditional beliefs also influence the health related exposures, particularly in the rural and tribal regions. Let us an example like Northeast India, Manipur and Nagaland, like tobacco uses. High rate of tobacco consumptions including chewing tobacco and smoking are prevalent in northeastern states like Nagaland and Manipur, leading to an increased incidence of oral and lung cancers. For instance, Manipur has one of the highest rates of tobacco related cancers in the country. And then we have western India like Rajasthan, traditional medicines. In rural Rajasthan, reliance on the traditional medicines and home remedies often delays treatment for serious health conditions leading to complications. This is particularly evident in the treatment like the conditions like tuberculosis and gastrointestinal infections, whereas people may first seek traditional healers before going to a doctor. Then region wise health related exposure, for example, northern India. Regions like Jammu Kashmir and we have Himachal Pradesh, Punjab, Haryana and Uttarakhand, the common health issues respiratory disease due to high level of air pollution, especially in urban areas like Delhi, NCR, and respiratory problems like asthma, bronchitis and chronic obstructive pulmonary disease are prevalent. Then cold related ailments like in hilly areas, hypothermia and frostbite are common during winter months. Then vector-borne disease like dengue and chikungunya outbreaks occur due to mosquito breeding in the monsoon seasons, especially in low-lying areas or waterlogging areas. Like in the western area, for western India for example, Rajasthan, Gujarat and Maharashtra, Goa, in these regions there are common health issues like heat related illness. Heat strokes and dehydration are common in the arid regions like Rajasthan during the summer seasons. Waterborne disease like cholera, diarrhea, hepatitis A are prevalent during monsoon, especially in areas where poor sanitations. Okay. Then leptospirosis are common in Maharashtra, especially in Mumbai during monsoons due to flooding. Okay. And we have like cardiovascular disease like high levels of urbanization and lifestyle changes have led to an increase in hypertension and diabetes and heart disease. Another factor like in the eastern India region specific. So, Bihar, West Bengal, Odisha, Jharkhand, common health issues. What are the common health issues in this eastern India? Like malnutrition, tribal populations, remote areas, not accessibility to the health, high prevalence of malnutrition, especially among children in the rural areas in this area. Then vector-borne disease like malaria is common in forest and tribal areas in Orissa, Chhattisgarh and also in the some parts of Bihar and Jharkhand. So, we have also like flood related disease, areas like Bihar and West Bengal faces frequent flooding like Kosi river in Bihar always flooded. So, Kosi is known as Horror of Bihar, their flooding is also outbreaks leading to waterborne disease such as cholera and typhoid. Then another factor which is very important also, as I have already told, that is like arsenic poisoning in West Bengal, particularly in the Gangetic plains. Arsenic contaminations in groundwater has led to chronic health issues. Another like in the southern India, for example, southern India regions, what are the vulnerability assessment or risk factors like Tamil Nadu, Kerala, Karnataka, Andhra Pradesh and Telangana. The common health issues in these states are like vector-borne disease. Take example of Kerala. Kerala has seen like outbreaks of disease like dengue, chikungunya and Japanese encephalitis, especially during the rainy seasons. Then we have waterborne disease like coastal regions are prone to disease like leptospirosis and also gastrointestinal disease. Then lifestyle disease like urban areas in states like Karnataka and Tamil Nadu have a high prevalence of diabetes, obesity and hypertension due to changing lifestyle. When there is a facilities like more literate people, lifestyle changes. Then also disease like a lifestyle disease. Then seasonal flu in Kerala experience outbreak of viral during monsoon seasons. Then in central India regions like Madhya Pradesh, Chhattisgarh, common health issues are like malaria, tribal dominated area, endemic in the forested and rural areas, particularly in tribal regions, and unhealthy and no use of mosquito nets also added to that for increasing cases of malaria. And the diarrheal disease like common due to the lack of clean drinking water and poor sanitation, and often due to their cultural practices, tribal people are also eating drinking water from outside there. Like then another factor tuberculosis like high prevention particularly in the underprivileged communities, okay, in the tribal dominated areas on the underprivileged communities. Then we have malnutrition issues like like eastern India, malnutrition is a significant concern here, especially in the tribal dominated areas, and they do not have a proper full square meals per day, and because of that and all the balanced diet they did not use. So, because of that also malnutrition problem is very severe. Then northeastern India, particularly northeastern India regions like Assam, Arunachal Pradesh, Meghalaya, Manipur, Mizoram, Nagaland, Tripura and Sikkim, the common health issues in these states are also another factor because of this malaria like high prevalent particularly in Assam, other hilly areas and forested areas. So, HIV AIDS also some states like Manipur have higher rate of HIV prevalence, particularly due to intravenous drug use, and this also chronic obstructive pulmonary disease due to high level of tobacco consumptions. The pulmonary disease are very common in the Manipur and other states. Nutrition deficiency, high rates of anemia and other nutritional deficiency are reported, particularly among women and children also. Okay. So then we have northern India like regions like Jammu Kashmir and also Himachal and Punjab, Haryana, Delhi, Uttarakhand. So what are the policy interventions? Like National Clean Air Program launched in 2019 aims to reduce air pollution across India with a specific focus on critically polluted areas like Delhi NCR. So the program sets targets to reduce the particulate matter and particularly PM 2.5 and PM 10 by 20 to 30% by 2024, which is already this year. So using measures such as reducing industrial emissions, promoting public transportation like spreading metro works across Delhi and encouraging electric vehicles. So those who are using electric vehicles also they have some tax assumptions, tax benefits. So integrated disease surveillance programs like active in the states like Uttarakhand and Himachal Pradesh, and this program focus on the early detections and response to outbreak of disease such as dengue and chikungunya, which are prevalent during the monsoon seasons. Examples are like the odd even schemes in the Delhi is an example for a policy aimed to reducing vehicular pollutions implemented by the Delhi government. It restricted the cars on the road based on their registration number on a specific day. So then we have in the Western India, for example, regions like Rajasthan, Gujarat, Maharashtra and Goa. What are the policy interventions? Like heat action plan implemented in cities like Ahmedabad and Gujarat across Rajasthan also. These plans include early warning systems, public awareness campaigns and adjustment in the working hours during the extreme heat waves to prevent heat related illness. For example, peak heat you have to close all these office hours. So Swachh Bharat Mission, this national initiative has a significant impact in the rural areas of Rajasthan and Maharashtra, focusing on the improving sanitation and reducing open defecations, thereby thereby lowering the incidence of waterborne disease like diarrhea and cholera. Then National Program for Prevention and Control of Cancers, Diabetics and Cardiovascular Disease and Strokes. In states like Maharashtra and Gujarat, this program aims to screen, diagnosis of and managing of non-communicable disease such as diabetes and hypertension, which are becoming increasingly common due to lifestyle change. Examples like Ahmedabad's heat action plan is one of the first in South Asia, and incidents that includes initiatives like training health workers to identify and treat heat related illness, establishing cooling centers and modifying working hours for laborers. Avoid the peak heat hour for the laborers. Then Eastern India regions for policy interventions, let us see Bihar, West Bengal, Orissa and Jharkhand. The policy interventions like Rashtriya Kishore Swasth Karyakram, a program targeting adolescent health like Rashtriya Kishore programs, Kishore Swasth Karyakram is particularly active in the states like Bihar and Jharkhand, and most of the area where it is tribal dominated, this Bihar and Jharkhand addressing the issues such as malnutrition, early marriage and reproductive health through health education and different types of various health related services. Then arsenic mitigation programs in the West Bengal, the government has launched initiative like the installation of arsenic removal plants and promoting the use of alternative water resources to address arsenic contamination in the drinking water. Then flood management programs in flood prone areas of Bihar and West Bengal, the government has implemented disaster management plans that include setting up temporary medical camps, distributing clean drinking water and providing vaccines to prevent the outbreak of waterborne disease during floods. Examples like the Arsenic Task Force in the West Bengal coordinates the efforts to mitigate arsenic contamination, including the implementation of the safe drinking water, like provide safe drinking water and supply systems, and also health checkups for affected populations. Then southern India regions like Tamil Nadu, Kerala, Karnataka, Andhra Pradesh and Telangana, policy interventions, vector-borne disease controls programs active in states like Kerala and Tamil Nadu. This program focus on controlling disease like dengue, malaria, chikungunya through mosquito control measures. Public awareness camps and timely medical interventions are provided to them so that it can be monitored. National programs for health care of the elderly. In the states with aging populations like Kerala, this program provides comprehensive health care service for the elderly, addressing issues like chronic disease, mental health and mobility problems. Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana, also this national health insurance scheme is particularly effective in the states like Tamil Nadu, Karnataka, and providing financial protections and access to quality health care for vulnerable populations. Examples like Kerala as dengue control campaign includes initiatives like source reductions, eliminating mosquito breeding sites, public awareness drives and early diagnosis and treatment of dengue cases through different types of government health centers. Then central India region like Madhya Pradesh and Chhattisgarh, policy interventions like malaria elimination campaigns in malaria endemic regions like Bastar in Chhattisgarh. The government has launched intensive campaigns to distribute the insecticides treated bed nets, like conduct regular fumigations, giving foaming of all these areas and provided rapid diagnostic tests and treatments. Then we have national nutrition missions, which is known as also Pushan Abhiyan. This mission targets malnutrition in the tribal and rural areas of Madhya Pradesh and Chhattisgarh by promoting better nutrition practices, distributing supplements and enhancing maternal and child health services. Mostly these are tribal dominated belts. Then tribal health initiatives focused on the improving health care access for tribal populations. These initiatives include mobile medical units like establishment of primary health centers in remote areas and training local health workers in the states like Chhattisgarh. Examples like Chhattisgarh's malaria Mukt Buster Abhijan, malaria free buster campaign has significantly reduced malaria cases in the tribal areas through the extensive distribution of mosquito nets and community awareness programs in the Buster. So, Buster is very well known tribal area. So, Buster, like another we have northeastern India regions, for example, Assam, Arunachal Pradesh, Meghalaya, Manipur, Mizoram, Nagaland and Tripura and Sikkim. We have what are the policy interventions like National AIDS Control Program in Manipur and Nagaland, whose HIV and AIDS prevalence is relatively high. The government focus on the on harm reduction strategy, including needle exchange programs and awareness campaigns targeting high risk populations. Then we have another like health and wellness centers under Ayushman Bharat. These centers are being set up across northeastern states all these northeastern states to provide comprehensive primary health care, including service for non-communicable disease, maternal and child health and mental health. Then for example, tuberculosis control program. In Assam and other northeastern states, the revised National Tuberculosis Control Program focuses on early diagnosis and treatment of tuberculosis, particularly remote and tribal areas. One such example is like the Manipur State's AIDS Control Society implements targeted interventions for high risk groups, including sex workers and injecting drug users to control the spread of HIV and AIDS in the region. Within that, if you see there are many such factors which are like policy interventions are also state specific, region specific, we have already discussed. And concluding this lecture, I would like to show the learners recognizing these region specific health challenges, the Indian government has implemented a range of policy interventions tailored to address the unique needs of such areas where in each area have its policy, through that they can control and monitor this disease. So, initiatives like the National Clean Air Programs aim to reduce pollution levels in critically affected areas, while the heat action plan in Gujarat and Rajasthan focus on mitigating the impacts of extreme heat. Similarly, like programs like the Swachh Bharat Mission have significantly improved the sanitation and reduced the incidence of waterborne disease in rural areas. And additionally, we have like the health campaigns like the malaria elimination programs in Chhattisgarh and dengue control campaigns in Kerala have been instrumental in controlling vector-borne disease. However, the success of these interventions relies on directly like the government initiatives and programs, how the people are very ready to access these government policies. So, like implementation of or community participations and continuous monitoring of such cases are there in these areas. While national problems provide a framework, local adaptation and responsive to emerging health threats are very crucial. Okay. So, among them the other like the involvement of local communities, awareness campaigns and robust healthcare infrastructures are essential for sustainable health improvements. Moreover, addressing the underlying determinants of health such as poverty, education, access to clean water and sanitation remains critical for all the areas. Within the multi-sectoral collaborations like including partnerships between government and non-governmental organizations, we have like integrated like national and international agencies is necessary to tackle these complex health challenges. Finally, we can say the health related exposure in India reflected in the country's diverse, we have diverse cultural and also we have diverse topographical, from southern India to northern India we have different regional diversities, regional characteristics and require a comprehensive region specific approach to public health. So, by understanding the unique health risks of each region and implementing targeted policy interventions, India can work towards reducing health disparities, improving overall health outcomes and building a resilient healthcare systems that can adapt to evolving needs of the populations. So, continued focus on prevention, early detections and effective treatment coupled with strong environmental and social policies will be key to achieving sustainable health improvements across the country. And within this also we have provide some literatures references for this for the learners to read some materials, and I hope this basics of exposure, risk and vulnerability, this area specific, region specific within India, with each and every region we have addressed what type of disease they are facing and what are the prevalent disease, how they are prone to different types of exposures, and also what are the government policies, how NGOs and agencies are working in these states from tribal dominated areas of Bastar or from Chhattisgarh or maybe Orissa, Madhya Pradesh, Bihar, all these parts from South India to North India, from Eastern India to West India, we have detailed discussed in this topic. So, I hope all the learners has been benefited from this lecture of how to deal with this basic exposure, risk and vulnerability. Thank you all.